out to the communities first. The first call is that we need to shift from reaction to stabilization mode in this crisis. There are 5 pandemic stabilizers to keep mortality down. 1, increasing vaccine uptake. 2, administering a booster. 3, doubling the rate of mask wearing indoor. 4, ventilating crowded spaces. And 5, adopting rigorous therapeutic protocols for severe cases. My second call is to create COVID-safe learning for young children so that we can avoid school closures and home learning. It is not unusual today to see 2 to 3 times higher incidence among young children than in the average population. The health risks extend beyond the children themselves. As school holidays approach, we must also acknowledge that children contaminate their parents and grandparents at home, with a 10 times increased risk for these adults to develop severe disease, be hospitalized, or die when non-vaccinated. The use of masks and ventilation and regular testing should be a standard at all primary schools, and vaccinating children should be discussed and considered nationally as part of school protection measure. Vaccination of younger children not only reduces their role in COVID-19 transmission, but also protects them from pediatric severity, whether associated with long COVID or multi-system inflammatory syndromes. Finally, my third call is not to mandate vaccination if one has not reached out first to the communities. Mandates around vaccination are an absolute last resort and only applicable when all other feasible options to improve vaccination uptake have been exhausted. They have proven effective in some environments to increase vaccine uptake. But the effectiveness of mandates is very context specific. The effect that mandating vaccination could have on public confidence and public trust, as well as vaccination uptake, must be considered. What is acceptable in one society and community may not be effective and acceptable in another. Mandates must be supported by appropriate policy considerations, a comprehensive implementation plan, including provisions for exemptions, and a strong communication component for the population. Ultimately, mandates should never contribute to increasing social inequalities in access to health and social services. Any measure that may restrict a right or movement of a person, such as lockdowns or mandates, needs to assure that mental health and well-being is cared for, that a means of prevention, early detection and management of domestic violence is in place, and that microeconomic support is available to those most affected. So be it points 1, stabilization of COVID-19, point 2, safe schooling, or point 3, dialogue on mandates and other public health and social measures, the dialogue with the communities needs to remain the cornerstone of the response. Omicron is in sight and on the rise, and we are right to be concerned and cautious. But as I said, the problem now is Delta, and whoever we succeed against Delta today is a win over Omicron tomorrow, before it eventually surges. We are in the business of stabilizing a pandemic, and that means not one variant at a time, but all variants at once. Thank you.
Thank you, Regional Director, for your opening remarks. And with that, let's move now to those journalists calling in. And I see a few hands up already. So without further ado, if I can go to Johanne Monte from RTBF, please unmute yourself.
Yes.
And ask your question.
Good morning, Dr. Kluge. You say not to recommend mandatory vaccination, but Would it make sense to mandate vaccination for healthcare workers, for instance?
Thank you, Johanna. So the principle is that we have to do everything possible to convince the people. The percentage of people who are hardline anti-vaxxers is ultimately small. Often the people have legitimate questions, and the communication and information is very important. Of course, it's also true that without vaccinating the healthcare workers, we're not going to get out of the acute crisis of the pandemic, and that the healthcare workers are in close touch with many vulnerable people. Several ministers cautioned me to anticipate that if the vaccination is mandatory for healthcare workers, that it should not drain the last group of nurses who are still in the hospitals. But of course, we need to do everything possible to increase the vaccine uptake within a legal and cultural context of each specific community and country. Thank you.
Thank you, Regional Director. Dr. Datta, would you like to add anything?
Thank you so much, Banu. I think Regional Director outlined the considerations very clearly. And Johanna, just to reiterate what Regional Director has said, it is extremely important that when we talk about the healthcare workers, we also need to really look into the drivers and barriers of vaccination in that population group. What is driving some of the healthcare workers to receive the vaccine in some countries or within the country, but also what are the different constraints that they have. If they have any concerns, and I think as we had been telling in several of our press conferences, that healthcare workers in the COVID-19 vaccination are the central pillar. They either make it or break it because they receive the vaccines by themselves and they also provide. If they are not convinced themselves on the safety of the vaccine, effectiveness of the vaccine, they will also, it's unlikely, they will promote this vaccine to the other recipients. In terms of, I think, protecting the healthcare workers is extremely critical. As you have heard the Regional Director say, that they will ensure that the health system functions in its own capacity. This is also important that there is a role to protect the vaccines and the healthcare workers in their own capacity, but they also have a role and a responsibility to keep others around them safe. So I think it's extremely critical that we keep the health system running. Thank you, Anna.
Thank you, Dr. Datta. Going next to the AP's Jamie Keaton. Jamie, please ask your question.
Good morning. Nice to see you all. Dr. Kluge, I had two quick questions. The first is you mentioned children in schools. In Switzerland here, we just had the government decided against mandatory testing in schools because the regions resisted it. And I'm just wondering, because it's a logistically very difficult. So my question is, how do you square that circle to encourage schools to be testing regularly for vaccines for COVID-19? And if I could just add really quickly, how encouraged are you? Are the signs that Omicron may not be as severe as it may have been first thought, as Dr. Fauci and others have mentioned? Thank you so much.
Thanks, Jamie. So on the testing, so we have the 5 pandemic stabilizers, but testing is not just a stabilizer. Testing is the cornerstone. We need to know where the virus is and where it is spreading, and it needs to be free of charge. In some countries, this poses quite a considerable financial burden on the people. So testing, contact tracing, quarantine remains really a cornerstone to push back this pandemic. Second, on the Omicron, we need a little bit more time. So we are generally concerned, and that's why it's a variant of concern, but we need to keep the head cool. It's too early to make definite recommendations on the Omicron, but Delta is still dominant in our region, and the tools are the same. So whatever we do to combat the Delta variant will benefit us in case ever Omicron would become much more dominant. And that goes back to the 5 pandemic stabilizers. Do whatever it takes to get the vaccination rate up. Boost, boost, boost. Double the wearing of masks. Only 48% of the people in Europe and Central Asia are wearing a mask indoors. If we would get to 95%, like in most of the Asian countries, we could save 164,000 lives by beginning of March. 4th, ventilation, particularly in schools. And 5th, new treatment protocols. Thank you.
Thank you, Jamie. Thank you, Regional Director. Let's go next to Nikolai Stevesgard at Reuters. Nikolai, please unmute yourself.
Yes, hello. Can everyone hear me? Hello?
Yes, we can hear you.
Okay, good. I wanted to ask a question on the European booster campaign, or everyone having the 3rd shot. So more and more countries are giving boosters to everyone, not just vulnerable people, after a certain amount of time. What is your view on this? Also, given the increase in infections in the region. Thank you.
Thanks, Nikolai. So the principle is that the booster is very important. In fact, we're moving from a booster to what we call a 3rd dose for people who got 2 doses as a part of a more comprehensive regimen, because we know now that vaccine-derived immunity is waning, particularly after 30 weeks. The priority is for the elderly people and the people with weakened immunity to prevent more mortality from severe disease, and for the healthcare workers to create a safe environment, and from there scale it up to the general population. Having said that, the top priority is to get doses to the people who received 0 doses, be it in Europe and Central Asia or globally. So you mentioned Dr. Fauci, and we're in regular contact. And since the beginning, we had the same vision, do it all. So we need to vaccinate with a full series and a booster the people, but at the same time, very important to continue to demonstrate international solidarity and share doses. There shouldn't be any dose unused or destroyed, which also means that countries which have a surplus to be faster in sharing the doses, because if the surplus doses are being shared too short before the expiry date, receiving countries often don't have the absorption capacity. And of course, at all price, we have to avoid that vaccines have to be destroyed.
Thank you. Dr. Datta, would you like to add anything there on additional doses?
Thank you, Banu. Thank you, Nikolai, for that question. And just to add on to what regional directors eloquently mentioned, the regional technical advisory group of experts have reviewed the available data from the WHO European region and what we are seeing on the 2 fronts. Number 1, as we have heard regional directors say, the priority for the region is that every eligible individual receives their 2 complete dose, or the complete dose series. Either it's 1 dose for Johnson & Johnson, and for others, it's 2 doses. So that remains one of our priority. However, as we're looking into the data, the technical advisory group of experts found that the vaccine-induced protection is reducing for the infection and the mild disease, which brings back to the question of having a booster dose or an additional dose. The individuals who have received inactivated COVID-19 vaccine need to get a 3rd dose or an additional dose right away. But this also relates to the elderly population groups and the healthcare workers, and the elderly population groups of more than 60 years of age should receive an additional booster dose when the country is making a policy level decision on having a booster in their own vaccination program. So hence the priority in the countries who are rolling out should remain at this point of time to again protect the vulnerables, whether with the 2 doses or the complete dose series or with the booster dose program. However, WHO keeps on reviewing the available data that is coming out on the wider use of the booster dose for its own population. We'll keep the member states informed as we gather and review the evidence as it comes along. But bottom line, at this point of time, it will be the vulnerable population groups and people with other comorbidities. Thank you so much.
Thank you, Dr. Datta. I'm going to go to a question received beforehand now from Lauren Chadwick at Euronews, who asks, based on what we're seeing happen in South Africa and current case rates in Europe, could Omicron become the dominant variant in Europe?
As of the 6th of December, there were 432 confirmed cases of Omicron in 21 of our member states. The best way to go forward in the time when more evidence is building up is the same path as the stabilizers, is to fight Delta, which will have the spillover effect on Omicron. So the 5 stabilizers, the vaccination, the booster, the mask wearing, the ventilation, and the treatment protocols. And as I mentioned in the press statement, the research we did with the European Centre of Disease Control showed that 470,000 lives were saved in 1 year by vaccinating. Most likely it's more because the study was done in 33 countries from the 53. So the vaccination plus approach in any case today remains the way forward.
Thank you. Dr. Smallwood, would you like to add anything to Ardy's comments there?
Thank you, and I'll speak just a little bit on Omicron. And as the regional director said, there's still a lot to be learned, but we're evolving and learning more with every day. So currently, as the regional director highlighted, there's already been quite widespread introduction of Omicron across the European region. We're seeing increasing numbers of case numbers, and the confirmed cases that we're receiving are, of course, those that have been genome sequenced. And so the true number is likely to be larger than that. However, the overwhelming proportion of COVID-19 cases in Europe at the moment remains Delta. That might change. Clearly, Omicron has demonstrated an ability to spread rapidly within a Delta context and within a highly vaccinated context, particularly in gatherings where COVID-19 likes to spread anyway. So Christmas parties, workplace gatherings, conferences. We've seen these clusters of Omicron appear in several countries across the region. So there will be further spread. The extent and the rapidity or the speed of that spread is still a question. And that we'll find out in a few more weeks. So as the regional director said, all of our countermeasures, so far, we have the information that they will continue to work against COVID-19. So we need to respond to all COVID variants, not just one at a time.
Thank you very much, Dr. Smallwood. Let's take a question from our journalist calling in now. Sarah Newey from The Telegraph, if you could unmute yourself, please, and ask your question.
Thank you so much. I'm interested that you talked about face masks in primary schools, and where I'm in the UK, that's not happening. Is it anywhere, and has that made it like an obvious difference to case numbers? And I just wondered also, which countries, if any, do you think are in the best place to combat a potential surge in Omicron that might be coming? Thanks so much.
So just to be clear, the first question is around how masks will affect transmission in schools.
Thanks, Sarah. So in several places, we see a 2 to 3 times higher incidence among the children and in primary schools than in the general population. I think important here is not to put the blame on the children or the primary schools, because they're only one element of the biotope, which is part of the larger community. So what we see in the schools reflects what's happening in the larger community since the beginning of the pandemic. Basically, what's happening is that transmission is ongoing in the non-vaccinated population, and for the time being, children are, of course, part of the unvaccinated population. That's what we are seeing. And there we need, again, the same kind of vaccination plus approach on that one. Thank you.
Thank you. I think we'll go to Dr. Dattav, if you'd like to add anything on keeping schools safe.
Thank you, Banu. So thank you, Sarah, for that question. And I think we need to just decipher the school setting into one of the important elements. The children in the school, they also come from the same community where the school is housed. And I think we have been telling that the school mirrors the community setting. But the school also provides a fertile ground for mixing pattern of the children from different households, from different communities. So and I think it is prudent that we look into the school environment and the children as a setting where they need to be protected from. And also remember, in the same school, we will be having children who are vulnerable, who have got some underlying medical conditions around it. So the practices, the public health and social measures, which are hard in a school setting to imply to, but I think that's extremely important, including what we are now discussing closely with the vaccination of the children. But it only relates to, remember, only one vaccine which has been evaluated for the use in the children between 5 to 11 years, which remains Pfizer, which are evaluated by EMA, the European Medicine Agency, and the US FDA. Thank you, Banu.
Can I just quickly come back on that? And it's really, I completely understand the idea that schools echo the wider community, but are there any countries that are doing that particularly well, that have introduced mask mandates in schools that has made a big difference to their caseloads? Thank you.
Thank you. Dr. Smallwood, would you like to elaborate on that one?
Yes, thank you. And our specific recommendations when it comes to children and the use of masks is very specific and will be evaluated and updated as our knowledge grows and as we study the transmission dynamics. For the moment, for primary school aged children, we recommend a risk assessment-based approach on masking for children. For children over 12, we recommend that the same policies are applied for children as they are for adults based on the local situation and context. So for schools, when we take a risk assessment view, you can't take masks in isolation. Indoor ventilation is incredibly important, as well as how well spaced the children are and other measures that are put in place. When it comes to countries that have done particularly well in controlling or keeping school-based outbreaks relatively low, we do have some data from some European countries, and this is particularly from August and September, when schools returned after the summer holidays. And some countries, including countries like France, did report lower incidence in terms of outbreaks in school settings. And it is true that France did maintain masking policies as well as other preventive policies in place in schools as children went back to school. But we're yet to further understand that, and we'll be reviewing the evidence on needs be. In terms of the second question on surge, it's very simple. The countries that will be in a better place if Omicron indeed does outcompete Delta and spread to become the more dominant variant, the countries at an advantage will be those that are at an advantage right now, seeing lower transmission, stable transmission, with an ability to implement both high vaccination uptake in combination with measures that control the spread of the virus. And that needs to be done while maintaining public support, public trust, and confidence in the measures that are applied.
Thank you very much, Dr. Smallwood. Let's go straight to Ashley Furlong at Politico. Ashley, please ask your question.
Thanks for taking my question. It's about the Omicron variant and the reaction we've seen from countries, including many European countries, in implementing travel bans. I'm wondering what could be done in the future to incentivize data sharing during outbreaks, and thinking with regards possibly to the pandemic treaty, do we need automatic release of funds to countries that share data about outbreaks, or, agreements to share vaccines or other medical countermeasures with them when they report these incidents? Thank you.
Indeed, a very timely question with the special session of the World Health Assembly, which finished last week and which was very much supported by the countries in our region, the European region, with an agreement to go forward with an intergovernmental process on a legally binding instrument, which is the should give an answer to your question, Ashley. We have to avoid at all price disincentives for countries to report. And in that sense, South Africa, Botswana really have to be commended to transparently share at once the data, because this has been a challenge in the pandemic. So bans on flights and transports, in this case for the Omicron, were in any case too late because the Omicron is already everywhere, and as surveillance capacity and genomic sequencing is going to be scaled up, more and more countries surely will report on the Omicron. Of course, at the very beginning, at the very early stage, it can give a little bit of breath to the countries to put measures in place at what we call the points of entry, and also to prepare the health systems better, particularly countries which are already overstretched. But the points you made are very, very pertinent, and this is being worked upon. And remember that this is why the WHO Regional Office for Europe established the Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, to rethink policy priorities in the light of pandemics. And one of the recommendations which had been implemented already is a G20 plus task force between health and finance, including representatives of regional organizations like the African Union, and Pan-European to have a Pan-European Health Threat Council, to have a forum where the 53 countries of Europe and Central Asia can come together to discuss policy coherence, for example, on still a very hot issue today, which is the COVID-19 certificate. Thank you.
Thank you, Regional Director. I'd like to go to Dr. Smallwood. If she'd like to elaborate there on the recent travel bans.
Thank you, Banu. And we've seen 43 countries in the European region impose travel measures on the basis of Omicron. This is certainly something that countries are within their rights to do. But WHO has said this many times, and it's also a feature of the international health regulations, that disease outbreaks are contained at their source, not at their borders. And travel bans, though they may be easily accessible in terms of political decision-making, are not effective in terms of preventing the spread of disease. And so they really are not effective. We should also note that travel bans have been imposed on countries that have not officially shared data, but for whom data is obtained unofficially, either through travelers themselves or through unofficial sources. So they are imposed, they are unfair, they do have economic consequences, but most of all, they're not effective.
Thank you very much. I'll take a question that we received beforehand now, and it's again from Euronews. They're asking, many European countries have resorted to lockdowns or strict measures on people who are unvaccinated. Does WHO support them, and have they been effective at limiting transmission? RD, would you like to comment on that, please?
So this is the main reason why it's so important to shift from a reactive mode to stabilizing the pandemic. That the earlier countries are responding, this is not to limit freedom, but it's basically to avoid such a painful individual and economic measures as a lockdown. So that's why it's very critical to go down what I call the vaccination plus path, to vaccinate, booster, but also implement all the other public health and social measures. Now, of course, extraordinary situations require extraordinary measures, and it's again a country's competency and decision to do so. The lesson we learned is really to safeguard as much as possible the mental health of the people, not at least the youth, but also the healthcare workers. We know that anxiety and depression is really skyrocketing. This is number one. Number two, in any crisis, we know that domestic violence is increasing, including domestic violence to children, intimate sexual violence. If schools are being closed, we saw that the calls from schools to call centers to have an alert that there may be a problem in domestic violence for children decreased with 1/3, so there's an alarm signal. And then third, there's also a need for microeconomic support, very targeted for those people who are affected most. Of course, they do work, but there has to be the balance between life and livelihood. It has to be tolerable for the people, but discriminating between vaccinated and unvaccinated in tough ways, have to be very careful that this does not increase tensions in the society, and we see already quite some violent protests. But for example, a COVID-19 pass, I always say, is not an infringing freedom. It's a collective tool towards individual liberty. And with anthropologists and social scientists, we're assisting countries through behavioral science to design community by community action plans to nudge the people to be vaccinated.
Thank you, Regional Director. Dr. Smallwood, if you'd like to comment, the question was around lockdowns on specific groups of people and what our position is at WHO.
And the question was really around unvaccinated individuals. And here we need to really remind ourselves very clearly, what is the purpose of the vaccination campaigns in Europe and across the world? And this is to protect people from hospitalization and death from COVID-19. Is this being reached? Yes, this is an objective, and the regional director clearly described this. 500,000 lives in the European region between December and November have been saved, at least, possibly a vast underestimate. And this is clear. But to control transmission, we need more than the vaccine. We need all of the measures that identify and interrupt transmission chains and disrupt the way that the virus will spread. And we have the tools at the moment that allow us to do both, to protect our lives and to protect our daily lives. The success depends on how and when we apply these tools. When countries are having to resort to last resort measures such as lockdowns or discriminatory interventions that really create distrust and apathy at the population level, then they have not used the tools that we have available to us in the appropriate manner. We can do better, and we must. And as the regional director said, we need to come to a position of stability. This is something that we all want in our daily lives, so we can plan ahead, we can plan our work, we can plan our public health interventions, and we can give some stability to our societies and our economies.
Thank you, Dr. Smallwood. Let's go to a journalist calling in now, and Moshe Appelblatt from the Brussels Times, I believe. Moshe, please do ask your question.
Yes. Hello. Thank you very much, Banu. I would like to ask perhaps two related questions to Dr. Kluge, which concerns, let's say, European Commission's policy in recent time. You said in the beginning that it's important to demonstrate international solidarity and to share, let's say, the available doses. But the question is if that is enough. That brings me to my first question. It is about, let's say, the idea about a temporary waiver of intellectual property rights to the COVID-19 vaccines. As you know, I think that the Commission is against that, but it has instead come up with another proposal, which is called, I think, compulsory licensing. What is WHO Europe's opinion about that? And secondly, we talked a lot about the need for booster vaccination and so on. And I think you or someone else mentioned that vaccines, let's say the doses, the effectivity is waning, is reduced after, let's say, 30 weeks. But recently, the Commission proposed new, let's say, travel rules, which would, let's say, extend the validity of the, let's say, 2 doses vaccinations up to 9 weeks in order to give EU member states enough time to launch the booster vaccination. My question is, wouldn't that, let's say, be dangerous? Wouldn't that create some kind of dangerous gap in these three months when, let's say, the 2-dose vaccination will still be recognized for traveling in Europe? Thank you.
Thank you, Moses. So on the first point, at this stage, whatever the production capacity of the vaccine can increase needs to be considered, including technology transfer, licensing, but ultimately it's for the benefit of public access to quality products. I think the quality is very important. So many of those processes also takes a bit of time, and the quality assurance is key. But at this stage, we need a comprehensive approach of number 1, sharing, number 2, uptake, number 3, production. So again, any tool to increase production capacity is to be considered for the benefit of public access to quality products. Absolutely. Number 2, the question, yes, was on the boosters. So, as we were mentioning, it's an element of the 5 pandemic stabilizers. The priority here goes clearly, according to the available evidence, to people 60 years and above, the immunocompromised, and the healthcare workers, to avoid severe forms of the disease and deaths, and to create safe environments in the health worker settings. And of course, this has to be targeted and gradually scaled up. So the principle is there, but we also need to be pragmatic. Again, here, I would like to repeat my call for international solidarity. The COVID-19 is a global problem, so it can only be solved by global solutions. And we see it with the Omicron, how fast the variant is spreading. So we really need to join efforts that all the people eligible in the world are getting the vaccine. The targets are 40% by end of the year and 70% by mid of next year globally. Thank you.
Thank you, RD. I think Dr. Datta, would you like to elaborate on that, and in particular that move from 6 months to 9 months when it comes to being recognized as vaccinated?
Thank you so much, Banu. Thank you, Mose, for asking that question. So let me outline 2 very important principles that we should be all aware of. WHO has reviewed the available vaccine and its own effectiveness. It is still very effective. Let us not forget about it. It's still very effective in reducing severe diseases and deaths. All the pooled data that we have reviewed from all the published literatures is still showing that the current vaccine is effective in preventing hospitalization and deaths. There's no doubt around that topic. What the regional technical advisory group of experts have reviewed, they have reviewed the available evidence around vaccine-induced protection reduction in the infection and mild disease. But when the considerations was made by this regional working group, they looked into 2 different elements. One, the current upsurge of the COVID-19 cases in the WHO European region, and the availability of the vaccines in the countries. Those were the 2 important considerations that the technical advisory group has outlined in their recommendation. They said based on these 2 settings, they felt that the immunocompromised, the elderly population, and the people with underlying disease conditions need to be protected. And I think that goes back to the primary point, that the vulnerable should not be left behind. We have learned that the virus attacks the people who are vulnerable. So either it is a 2-dose schedule or a 1-dose primary dose schedule or the booster. Again, hence the recommendation is to go back to the basics, prevent have a very high coverage of the primary dose or the booster dose in the vulnerable. In terms of having this discussion around 6 months to 9 months, the effect of the booster is being looked into very closely with the available data that is emerging. We are looking very closely into the data about what is the protection level that is being offered, or what is the duration of protection that is being offered by the booster. We are still learning around it. As you would agree with me, Mose, the countries who have started to give the boosters is a recent event. So I think we will need to, I think we have to be honest in telling to our countries and our member states what we know at this point of time, what we don't know, and what we will be coming up with in the near future. And that is what we are working very closely with our European technical advisory group of independent experts on this, and we'll keep our member states posted. Thank you so much, Banu.
Thank you, Dr. Datta. Let's go now to Komsomolskaya Pravda. If you'd like to unmute, please, and ask your question.
Hello, thank you for taking my question. I would like to ask what can be said about the effectiveness of the vaccines against the Omicron variant, as it is supposed to have the ability to avoid the antibodies. So what can be said about the effectiveness of the vaccines against this variant? Thank you.
Thank you very much. Dr. Datta, would you like to take this one, please?
Thank you so much. Thanks for that question. And I think it's a very prudent question to ask at this point of time. As you have heard, Dr. Smallwood and our regional director, as earlier mentioned, the emergence of this variant of concern, Omicron, is new, and we are learning as with each every day about how this variant of concern would behave in terms of the existing vaccine. So I think it's too early to say at this point of time the effect of the vaccine on the Omicron variant. We are learning that from the South Africa, and the South African studies have are increasingly being made available. They have been very generous in sharing all the data with us. So we will be learning more in the near weeks. And the independent and the strategic advisory group of experts in the WHO headquarters, together with the vaccine experts from the South Africa, are reviewing the data, and we will be sharing the effect of the vaccine on this Omicron variant as more data becomes available and being reviewed. But I think at this point of time, while we are having this discussion, I think we should still remember what we had been telling until now. The current vaccines work. The current vaccines do reduce severe diseases and death. So I think we should not be swayed away from the fact that Omicron variant is here. There is no doubt that current vaccines are working. We need to keep using them as the tool that we have on our hand. Thank you.
Thank you, Dr. Datta. Dr. Smallwood, over to you, please.
Yeah, I'd just like to add that a lot of the concern that we have around Omicron is really based on what it looks like in terms of the mutations that it carries. And some of these mutations we have seen in other variants of interest and other variants of concern. And we do know that they are associated with immune escape. So the effectiveness of the vaccines against infection, but also against severe disease, will be really important to understand. And as Dr. Datta said, that will come as we're able to grow the virus and conduct the assays that we need to do. But at the same time, we do have data from South Africa that show that the risk of reinfection with Omicron is much higher, or is higher, significantly higher. And therefore, people who have had previous COVID-19 are at an increased risk of being reinfected with this new variant. They should, if they haven't already done so, go and seek vaccination. Do not think that just because you've had COVID in the past, that you're immune from it in the future. And vaccines will still, we hope, protect against severe disease and deaths from COVID-19, regardless of the variant. More to come soon. But we really need to take what actions we can take right now to reduce our own risk to COVID-19, both the acute forms and the long forms, so the post-COVID syndromes. And the best way we can do that individually is either to get vaccinated if we haven't already, but also to implement all of those measures that we know protect against transmission. So mask wearing, not visiting places that are crowded or confined, and making sure that we take choices and take those sensible decisions about where we go, where we spend our time, how we travel, if we're at risk of severe disease, to be slightly more cautious. Thanks.
Thank you, Dr. Smallwood. Very important message there. Let's go now to Esmir Milovic from N1 in Bosnia-Herzegovina. Esmir, please ask your question.
Good morning. And Director, nice to see you again after we saw each other at the start of this week. My question is the trend which you say that the 1 in 10 people will have been confirmed with COVID-19. should we expect to see that trend worsening in the months to come if we don't listen to your recommendations? And my second question is, the Wall Street Journal this morning is writing that the pills production could be pushed months away and would not be available to mid or low income countries in the future. So should we take the lessons from a vaccine production to increase that and ensure that we will have them in time? Thank you.
Indeed, very nice to see you again, Esmir. And on the first point, it's good to remind what the vaccines are doing and what they're not doing. So the vaccines are doing what they promised to do. It means to protect against severe disease and death, and thereby also preventing a collapse of our hospital system. But it's uncertain how much they interrupt transmission. So definitely, if the measures, and particularly the 5 stablers, are being delayed, absolutely we'll see more infection. And that's what we're seeing already in countries delaying implementation of the measures. Number 2, again, good point on the drugs, on the medicines. This comes back to an initiative that the office here started, the Oslo Medicines Initiative, to have a public-private partnership aiming at a equitable access to expensive medicines. And that's absolutely essential. Having said that, we should also remind that some of those drugs, even if they're expensive, they are less expensive, dear Esmir, than 1 day in the intensive care unit. So in that sense, we had this development also, and the antivirals on HIV/AIDS, which are terribly expensive in the beginning, and then through a global effort involving civil society, public-private sector, a drastic reduction in the price. So the price of the medicine should not stand in the way. Thank you.
Thank you, RD. Dr. Datta, and then Dr. Smallwood, please.
Yeah, thank you so much, Esme, for asking that question. And you have outlined and eloquently connected this both to therapeutics with vaccines. And I think the first point would be we need to learn very vividly from what we have seen from the vaccine inequity, both in access and in moving forward into the production. Regional Director has mentioned about in one of his previous response. There has to be short-term, which is vaccine dose sharing. We cannot afford to wait until the vaccine is being produced by different countries or the vaccine manufacturers. The second would be obviously making sure that the technology transfer happens both for vaccines and also now for the therapeutics. But remember, these things will not happen overnight. The important element is that we do see that what are the short-term measures, the midterm interventions, and obviously in the long term, which relates to capacity building, availability of the resources, and including the technology transfer that we have already seen within WHO's global effort. The last point I would outline here, there are tools available. The technology transfer is just one of them that WHO is engaged with. We are very much engaged with the capacity building at the local level, because just by giving a technology transfer will not happen overnight, because we want to see that either it is therapeutics or it is vaccine. We need to ensure there's a quality being offered or ensured in those production lines and moving forward. Thank you.
Thank you, Dr. Datta. Dr. Smallwood, over to you, please.
Thanks. I think we need to make this simple and remind ourselves that as a global human population, a global community, will come out of the pandemic together. And we won't do that if the COVID tools are not 3 things: available, accessible, and affordable. If those 3 things are not met, we will not do it. And I think there are some key interventions that, a lot of attention is placed at these high cutting edge technologies, but there are key interventions that are not expensive, that are already widely available, but that do require us to organize ourselves a bit better. Ventilation, clean air, the use of masking where appropriate, the use of other tools that are available to us, collective behaviors, trust, organization, and these things really need to be brought to the forefront. In terms of the question around 1 in 10 people in the European region who will have had a COVID-19 confirmed infection, at the moment, our case incident rates in Europe are higher than they've ever been before. So yes, that number will continue to climb, and it'll be a matter of choice, not chance, that it'll come down. And it's only in the past week that we've seen the first sign of stabilization in the European region, and we need to bring those numbers down. It's last year that we saw some of our most devastating peaks over the Christmas and New Year period, and we need to avoid that from happening again. So there are measures that need to be implemented right now in order to take the choice at the policy level, at the community level, and at the individual level to bring cases down.
Thank you very much, Dr. Smallwood. Regional Director, I'd just like to give you the floor for some closing remarks, if you have any.
Thank you, Mano, and everyone for participating. So to repeat our triple call, to shift from a reactive mode to stabilize the crisis, there are the 5 pandemic stabilizers: increase the vaccine uptake, administer the booster, double the rate of mask wearing indoor, ventilate the crowded spaces, and adopting rigorous therapeutic protocols for severe cases. The second call is to protect the children and their schools as part of the response strategy. If schools are to be closed, then absolutely there's a need to take care of the children of the healthcare workers and children with special needs like autism. And the third goal is not to mandate without reaching out to the communities. First, I wish everyone to celebrate, but to celebrate safely like we have been doing before. Thank you very much. Stay safe, stay healthy, and stay positive.
Thank you very much, Regional Director. On this note, let me close the press briefing for today. And as I said, thank you to the Regional Director. Many thanks to our panelists, Dr. Smallwood and Dr. Datta, for joining us online. And thank you to you, members of the press, for joining the press briefing. If you need additional follow-up, please do contact us by email using the details that were provided in the invitation. And as always, stay healthy and take care. Goodbye.